Hi, this is how the rapid urease test is said to be positive. RUT rapid urease test kit. So, I have got many questions regarding the positivity. The reading has to be completed within 1 hour. Okay, some literature says 3 hour. So, if it is positive, so usually it will get turned pink or red within 10 minutes only. We will come to know that whether it's a positive or negative within 10 minutes only. It starts changing its color. So this is the unused test kit. So before using it will be like in this color. So if it is negative, if it is yellow, then it's said to be negative. If it is turning pink or red, then it's said to be positive. So I get many questions asking like whether after 1 hour, after next 18 hours, 12 hours, my kit has changed its color, whether it's a positive or negative. See, H. pylori will change the color. Means if it is H. pylori infection, the change in the pH will takes place within 1 hour only. So the reading has to be completed within 1 hour only. So if anything changes the color after 12 hours, 18 hours like that, then it is a non-H. pylori organism which is changing the color. So before concluding, I would like to say one thing. So whatever the reading your gastroenterologist or a surgeon or your treating doctor gives, so take it as a final. So there are many factors which are playing in role which will influence the test, like taking the proton pump inhibitors, antacids before doing the procedures. So those also influence. So better to stop the H. pylori, PPIs 5 days prior to the H. pylori RUT test kit, RUT method of testing the H. pylori, and this is the most reliable method of investigation of H. pylori than any other investigations. So if you still have any questions about the H. pylori examination, then please write in the comment box. I'll try to answer. Thank you.